morning. Hi, everybody. We are just going to wait a couple seconds to let everyone migrate in, and then we'll get started. Okie dokie, artichokes. Let's jump in. Hi, everybody, and welcome to Better Sleep. Welcome to Better Sleep for Better Mental Health, brought to you by RWJ Barnabas Health, Association Member Trust, Focus New Jersey, Manufacturing Counts, NJBIA HR Support, and New Jersey Business Magazine. I'm Casey Skarecki, sponsorship sales here at the New Jersey Business and Industry Association. And with us today is Robert Winston of Behavioral Health, Jersey City Medical Center, and RWJ Barnabas Health Facility. A few housekeeping matters before we get started. Today's webinar is being recorded and will be emailed to you along with the PowerPoint for today's presentation, so be on the lookout for that. If you can't wait, you can download them right now from the Handouts tab, but I'd also like to draw your attention to the Questions tab. Robert would be happy to take your questions, so get them in as they come to you via the questions chat box. Dink, dink, dink. And if you, I think I said this, but if you can't make it today, there will be a recording that'll be emailed to you. And so you can always look at it at your leisure. So right now, I'm going to say, Robert, why don't you take us away?
Well, thank you very much. Hello, everybody. I will work on technology and how to share my screen. Oh, of course, I'm sharing the wrong thing. There we go. You know how technology works. Hi, everybody. Thank you again for the introduction. My name is Rob Winston. I do go by Rob. I have been a licensed clinical social worker for more years than I care to share with everyone here. But in addition to working here in our behavioral health department at RWJ Barnabas, where I've been for many, many years, I also have been in private practice doing psychotherapy and been doing this kind of work for quite some time. So I appreciate the opportunity to spend some time with you today and talk a little bit about my two favorite topics, which is mental health, of course, as I am a mental health practitioner, and sleep and kind of how they relate together and some things that we could do together. So we'll go ahead and we'll jump in a little bit right here. So as we do that, I just love the, chicken versus the egg, right? Which comes first? Does the chicken come first or does the egg come first? Does mental health issues affect our sleep or does sleep affect our mental health? So there's no easy answer to that. And neither one of these beautiful little things here are right? So everything kind of impacts each other. And we live in a dynamic world where we go in circles and we kind of do how everything impacts everything else in our life. So I don't want to make it seem like I'm only going to be talking about mental health and how that might affect our sleep. And I don't also want to talk just about sleep and how that might affect your mental health. So we'll talk about it as an integrated system as we all are. And I'm curious for the people out there, if you would like to join my Slido, which is going to be a little bit of a poll. What is something that negatively affects your sleep? So assuming you're here because sleep is important to you and the idea behind sleep potentially negatively impacts you, let's talk about a little bit of what might be affecting your sleep. What are some of the things that affect your sleep? So I'll give you a couple seconds here to join that, and then we will go from there. We also put it in the chat link. You can go to that link there, or you can do it via QR code or go to slido.com and enter in 1121633. I'm going to work at figuring out technology and how to pull that up. There we go. What is something that negatively affects your sleep? So that poll is active now. Anybody wants to jump in? One person. Stress, yes, of course. Overthinking. See a couple more people typing, so we'll hold on for just a second here. Anxiety, yep. Screen time. Ah, waking up, too much caffeine. Kids, yeah. Worrying about work, waking in the middle of the night. So a lot of great information here. I see a couple more people typing, so I'll give it 2 more seconds here. We'll see what's electronics. Yeah, we'll talk about that. We're going to talk about almost everything on this list, and kind of how that impacts and what we can try to do about it. Work, yeah. Family issues, waking frequently. All right, so we'll give it 1 more second. Partner snores. That is a great one too. We will also talk about that. Weather, that's interesting. We'll talk about that a little bit. I will go ahead and close this poll. Thank you guys so much for participating. Keep your Slidos open because we're going to do 1 more a little bit later on. That'll be a lot of fun as well. So let me figure out how PowerPoint works and we'll go back to that real quick. There we go. So thank you, everybody. We'll talk more as I learn again how to use a PowerPoint, a little bit about any of that thing. So a lot of the stuff you mentioned is here, right? So we talk about what are 6 common reasons for sleep issues. Stress, of course, you know, we are human beings and we're really programmed to manage stress in interesting ways. I love that second picture of coffee being literally mainlined into our body. As somebody who's been on his, you know, 2nd cup of espresso this morning, to make sure I have a lot of energy to go on. So the first picture and the second picture I want to talk about, like there's the external stresses, which you guys talked about. Work, maybe kids, family life, partners, all that kind of stuff. And then secondly, the internal stress that we do. Sometimes I know a lot of people think a lot, right, in their minds, and we can't get our minds to stop right before bed, whether it's the external stress that's driving the internal stress, or just maybe even something else that goes on in our minds. So we'll talk a little bit about that. One thing people didn't mention was heavy meals. Heavy meals definitely have an impact on our ability to sleep at night, and we'll talk a little bit that. Hormones, especially as we age and what that looks like across time. And despite what everyone wants to believe or what everyone wants to think, drinking certainly does impact our sleep in a negative way. While having some booze before sleep can sometimes make us tired, we are not necessarily getting good quality sleep and not necessarily staying asleep for the entire evening. Some other things to think about as it relates to sleep. Sometimes medications we take can affect our sleep patterns. And pets. I have 2 beautiful babies. You'll see a picture of one of them later. And I will admit they do sleep in my bed, but it's honestly not good for them or for you to sleep with your pets. Although I'm never going to tell anybody not to sleep with their fur babies because I'm not going to do that because I'm not willing to do that because if my fur babies want to lay with me, then they can. Certainly pain can influence our ability to sleep. We talked about this already. Our partners who snore can absolutely impact our sleep. Bad mattresses or old mattresses that don't provide the support we need while we sleep. And sleeping disorders, which we see a whole bunch of them here, of different types of things, whether it be sleep apnea, snoring, narcolepsy, sleep paralysis, sleep talking, restless leg syndrome, insomnia, or exploding head syndrome. We're going to talk a little bit real quick on sleeping disorders, and then I want to really stay into more of the mental health kind of stuff as we go along. So in thinking about sleep disorders, the most common one that you see, it's estimated, as you can see on this slide, it's estimated that over 22 million people suffer from sleep apnea. 80% of those cases are either undiagnosed, moderate or severe obstructive sleep apnea. And what that is, sleep apnea, obstructive sleep apnea, is the most common sleep breathing disorder. During a obstructive sleep apnea, breathing becomes shallow, repeatedly stops throughout the night. Pauses in breathing can last a minimum of 10 seconds to over a minute and a half. So think about that, 90 seconds of not breathing adequately to support your body. This causes severe drops in oxygen levels and can disrupt sleep hundreds of times per night. Think about that. Hundreds of times per night, your sleep is disrupted. How are you supposed to get quality sleep if hundreds of times that this is happening? With this, muscles in the back and the throat relax, which sag and which block the airway. Although you try to breathe, the lungs are not able to adequately fill with air. The severity can be categorized as mild, moderate, or severe. This can be treated once it is diagnosed, and we'll talk a little bit about what that treatment looks like as we move on through the presentation. But this is something that certainly has to be in our awareness and has to be out there for us to take a look at, and how easy it is if to make an appointment at a sleep center and get this looked at if you're having sleep difficulties. So we'll talk a little bit more about that as we get into some of our patterns. I still learn how to use PowerPoint. We'll go back to Slido real quick. One more time. It's the same thing. I'm going to open this up real quick. And the question now will be, how much sleep do you get per night? So that'll be the next one. It is now open, I believe. So you should be able to do it. Let me just share this. Here we go. 5 hours, 5 to 7 hours. 5 to 7. 5 to 7 seems to be the winner. Less than 5 hours, we have one person. Less than 5 hours. It seems like the majority of folks are in the 5 to 7 hour category. So while you guys are doing that, I want you to think about, what do you think the right amount of sleep is for you as a person, and what does normal mean? I will give you some answers to that as we go along, but I love the idea of what is normal, because as a therapist, it's kind of an idea that I always throw out the window, because I don't believe that there is anything such as normal. However, when it comes to how much sleep you get per night, there are certainly guidelines and recommendations of what's going to help you be most functional during your days and how you work. So I'm going to go ahead and like I said, it looks like most people are getting 5 to 7 hours per night. I got to be honest, that's typically what I get. We'll go back to the PowerPoint. If I once again can, here we go. So as you could see here, this is coming from the National Sleep Foundation. I'll give you a link to that as we kind of go along, but this is the recommended. Adults are recommended to get 7 to 9 hours of sleep per night. So a lot of us are under that. And that's okay, because again, we don't know what normal is, and that's probably why we're all here, right? You could see teens get a little bit more. School-age children should be getting more. Preschool, toddlers, infants, and newborns. And you could see the range of how much sleep you are supposed to get. And as we age, we typically get less sleep, even though the recommendation still remains 7 to 9. As we age, we typically wind up sleeping less. Sleep provides amazing benefits, lower stress and improves mood. That's what we're here to talk about. Helps maintain a healthy weight, improves athletic performance and coordination, and increases our ability to pay attention and remember new information. And again, we'll talk into a little bit about that as we keep going. So what are some things that can help us actually get a good night's sleep and to sleep like a baby? I think the first thing I want to talk about is a sleep schedule, because I think that this is one thing we, especially I think in our country, in our society, in business and industry, I think this is something we struggle with, that we go to sleep and we wake up at the same time every single day. Especially on the weekends, that can be very, very, very difficult. However, I will tell you, we are creatures of habit, right? Human beings repeat the patterns of their life over and over and over and over again throughout their entire lives. And the only time we disrupt them is when we actively try to disrupt these patterns. So if we think about life being a series of patterns, sleep is certainly part of that thing. And I think one thing that people struggle with is, well, I try to go to bed the same time every night, and I sometimes struggle with that. And my recommendation for everyone is to actually start in the opposite direction. Try to wake up at the same time every day, and then back into what time, the right time to go to sleep based on what that looks like. This is not always easy to do, but it's certainly the dip your toe in the water kind of idea. By the way, everything I talk about as we do here, I'm all about dipping your toe in the water. Again, being a therapist for a very, very long time, it's this idea of abstinence versus moderation. And I really am one to say, let's moderate how we do what we do to get to our goal. If we just all of a sudden decide that we're cutting everything out and we're going to try to do everything perfectly on day one, it sets up a scenario when we're not perfect, we wind up being very hard on ourselves. That is not helpful towards this. So we're going to take our perfectionism, we're going to take our desire to do the right thing, we're going to set it to the side, we're going to thank it for taking care of us, because that's all it wants to do. It wants to take care of us, it wants to be there for us, and we're going to set it aside. We're going to thank it. It's nice. We're not always going to be perfect. So we'll start slowly. We'll think about what time is the right time to wake up every day, and then we'll back into what time is the right time to go to sleep so I have enough sleep to get to that waking time. Bedtime rituals. We're going to talk a lot about bedtime rituals. I'm going to start, and I'm going to describe a little bit of what I've seen to be effective, both for my patients and also for me, to be perfectly honest. Some bedtime rituals, and you guys all talked about it, screen time, all the things that we do before bed that probably are not very good, but having a ritualistic pattern of events that happen preceding your actual moment of going to bed can be super helpful because it's setting you up in two different ways to get to sleep in the most effective way. The first way is physically. So your physical body has a memory, right? And that memory knows then at a certain point in time what's coming next as long as we sit in this ritual. Um, and in the physical perception, that's what makes us physically sleepy and physically tired because our physical body knows our ritual has started and we're getting ready to go to bed. Psychologically, our thoughts and our racing mind and all the stuff that's going on works the same way. If we understand the ritual of how we're doing what we're doing, it will help. I will tell you, for my fur babies, they know the ritual so well that they help me with it. I happen to be a very, very, very big hockey fan, and it's the playoff season right now. So I'm struggling with my sleep schedule and my bedtime rituals because the NHL decided to make the games later than usual, especially Sunday night. I'm a New York Rangers fan. They played at 8 p.m. They normally start at 7. You don't need to know any of that, but what you do need to know is I tried to go to bed, and my normal go to bed ritual time is I'm in the bed at 10 o'clock. And my fur babies know this, and they will meander right on in, hop into bed, get into their ritualistic positions of where they sleep, and we're all set. Because the game was still happening, I did not go to bed at that time. And my fur babies literally were trying to get me to participate in the ritual since I wasn't doing it myself. So even they understood. And, I have cats. It depends on what your fur babies are. Cats are super ritualistic, very much organized in that way. And of course, they can sleep whenever they want. But that was interesting how I was breaking my ritual and they became actually frustrated that I wasn't going to bed with them at the right time. We'll talk a little bit more about what those ritual like and how we can really set ourselves up for psychological success in those rituals and physical success in a couple more slides. Another thing you want to do is try to avoid napping. Now, I am a professional and I love a good nap. I actually do think in some circumstances and sometimes it could be helpful to actually have a nap to actually help you get refreshed and re-energized. I think there is something to be said a little bit about this European mindset of a little siesta in the afternoon. However, in our society, that is not the way we've structured. And if we nap, especially if we nap too close to our actual bedtime ritual, it's going to disrupt our ritual. My rule for myself is no naps past 5 p.m. My second rule is if you are going to have a nap, have it structured with a time limit. You do not, napping for several hours is not napping, that is sleeping. And that's okay. If you need to do that, you need to do that. But however, I limit myself. What works for me is a 20-minute nap. It gives me just enough to kind of refresh and re-energize. However, I do try to avoid them, especially because I'm not going to be napping here at the hospital. Exercise daily, keeping our bodies in motion, allows our physical body, coming back to that ritual, right? Coming back to our physical sense, it allows our physical body to get tired. I know I attempt to hit my step count every single day. I am also a person who has spent a lot of time over the last 5 or 6 years on a weight loss program and attempting to lose weight. And so this has been kind of a dual focus for me of having some exercise in my daily ritual. It also helps us in so many other ways, having some exercise. And by the way, when I say exercise, I'm not talking about you have to do heavy exerted exercise every single day. I mean, keeping your body in motion. I look to my 80-year-old mother, who I just think is fantastic. And I mean, who doesn't, right? But this little old Italian lady, and she goes for a 2-mile walk every single morning. And again, is she the fastest? No. Is she making her way through it? Yes, she is. And it's about keeping her body in motion, keeping things moving. And again, if we have some type of ritual where we keep our body in motion even a little bit. And I also say, as a person who typically sits in an office all day, I went to a meeting yesterday and I made some people anxious because I didn't sit down. And I was like, well, I want to stay standing. I want to be able to keep my body moving a little bit because I've been sitting down all day. So it's something to think about. And again, it sets us up for that ritual of our physical body getting tired. Now, a lot of people say if you do exercise at night, it's setting you up to get yourself really tired. I will tell you that's true until it's not true. Doing some type of moderate exercise in the evening can make you tired and can help you get to sleep. However, strenuous exercise, and you can determine for you what strenuous looks like. Strenuous exercise can actually wake you up and get your body moving too hard, and then you're going to have a hard time falling asleep. Evaluate your bedroom. We're going to talk about that in just a second here, but some of the big ticket problems with bedrooms. What is the light seepage in your house? Do you have street lights that are looking into your window? Do you have night lights? Do you have alarm clocks? Do you have your bedroom set up for success in terms of making sure the actual physical environment is set up to sleep? And what does that look like? If you have a partner who flops around a lot, do you have a big enough bed that's able to support you? Or, and this is one thing that people sometimes don't always agree with me on, maybe you guys don't sleep in the same bed. Maybe there are two different beds. Maybe there's a different bedroom to use. We'll talk more about that in a minute, but I think it's important. My grandparents did this all growing up, and I never understood it as a little kid. But my grandfather slept in one room and my grandmother slept in the other room. And I always thought that was odd because I was a little kid. And it literally was because Poppy snored and grandma didn't want to listen to it because she couldn't sleep because he was snoring too much. And they both valued sleep so much that trumped sleeping together in the same bed. And it didn't mean that they didn't have their rituals of being physically together or being able to, have cuddle time and all that kind of stuff. Not that I need to know, or you need to know that about my grandparents. But it also meant when it was time for sleepy time, it was time for sleepy time, and everyone went to their sides, if you will. Comfortable mattress and pillow. I can't talk about this enough. It's really important to evaluate, is the mattress right for you? And when you are, I want to spend a brief minute here. If you ever do wind up deciding that, my mattress isn't giving me the support I want, I'm waking up sore, I'm not getting good restful sleep, it's an older mattress, I've had it for a long time, or the pillows aren't really supporting my head and keeping my head in alignment the correct way, and I'm waking up with that stiff neck and all of those type of things. It's really, really, really important if you go shopping to test run your mattress. And when I say that, what I mean is when you go shopping to the store, I made this mistake once and I learned very quickly. When you lay down to test the mattress, you need to lay there for more than just 1 second. You need to spend some time. And 2, lay on the mattress the way you lay on your bed. I didn't do that. I am a side sleeper, or even badly naughtily a stomach sleeper, even though that's not really the healthiest thing to do. But when I went to go test mattresses the last time, I'm laying there on my back and I'm like, this is comfortable. And the salesperson, thank goodness, wisely said to me, is that the way you sleep though? And I'm like, well, no. And then I flipped around to the way I normally sleep. I'm like, oh my God, this mattress is terrible. And he said, exactly. And then, again, a lot of times these mattress stores, they're really good at knowing, how to sell things, but also good at knowing, based on your style of sleep, what the right mattress is to guide you towards for a variety of different cost profiles. And by the way, the most expensive doesn't mean the best for you. So don't get caught up in that. But to make sure you do that. One thing that I also seriously recommend is make sure your pillows are giving you the support. Good test is if you fold your pillow in half and it doesn't fold back out, it's probably time for a new pillow. And bright lights. Let's talk a little bit about light and what light seepage looks like. There's a lot of rules now. We see some human beings here, right, doing lots of things as it relates to screen time, as it relates to lights in their room. So screen time, white light is going to wake you up, right? So if you have that white light of your phone coming at you, it's certainly going to wake you up. A lot of phones are coming with new filters and things. Let's talk about that for a second. The most important thing I will tell you here, because you could see there's red light, there's blue light, there's white light. What's the best light for you to stay in that sleep or get you towards that sleep? If we were in person, I typically ask people to raise their hands. Everyone has a different opinion. I will tell you that the right answer typically is red light. So I actually, when I learned this information, I changed all the night lights in my house, including my bathroom, because, we all have to get up in the middle of the night. Well, maybe not all. As we get older, we typically get up more. I put red night lights now in my house, and I will tell you, as much as I didn't believe it made a huge difference, it made an enormous difference in my ability to get to sleep and also to return to sleep after going to the bathroom. And that is what all the studies show. So blue light in and of itself wakes up a part of your brain. So most phones now do come with a blue light filter, and you should have some type of setting where at a certain point in time at night, the blue light filter on your phone certainly goes off. I will tell you, with the sitting in bed and looking at your phone thing is super unhealthy and super hard to avoid. We have become so much invigorated, if you will, and become part of our society and part of our natural way we do things is to have this in our hands at all times and to know things. And just ask the younger generation. I'm already antiquated at these things. However, I will tell you a lot of these things aren't good. Now, there is some good to the phone, which we'll talk about, because I know a lot of people read on their phones, they read books. I'm okay with that as long as the light filter is on, the blue light filter is on, and the background is dark. So it's not that bright white light. If you have a black background and like gray text, that can be somewhat helpful. On that whole reading in bed thing, though, what I also will tell you about reading in bed, and this is an easy one that you probably maybe didn't think of. If you are reading a book as part of your ritual towards going to bed, I highly recommend you read a book you've already read. What that does is it sets up your brain to know I'm reading in bed. It's part of my wind down routine. It's part of my slowing down my brain thoughts, getting my brain to focus in on something else, but it's not setting you up where now you're curious about what's going to happen next. Because a lot of times that happens in what we're doing. You're reading a good book. You want to know what happens in the next chapter. And now your brain isn't learning or knowing it's wind down time. It's getting re-energized. So certainly those lights, to kind of sum that back up, we want to reduce the bright lights. We want to stay with red lights as much as possible. Use the blue light filter on your phone. And if you are reading before bed and you're reading on your phone, you want to make sure it's a dark background with the white light or the white letters or gray letters on them. And again, try to read a book you've already read. A lot of people fall asleep to the TV. I will tell you, I do not recommend it. Again, you're just bringing light into the room, and the fluctuation in sound from a television show can negatively impact your ability to sleep. If you do want some type of sound, and I understand that, some people fan noise, if you have a ceiling fan or a fan next to the bed, can be super helpful because it's creating white noise. If you need a white noise sleep machine, they do sell them. You can also listen to gentle music. I will tell you, I happen to be a hard rock fan. But I do not fall asleep to Metallica at night because, the change of tone of their music and the loudness of their music certainly would keep me awake. So I try to, I do fall asleep to music, and I recommend that you follow something that's consistent, easy to do. They also have some apps out there, such as Calm, such as some of these other ones that also have some sleep sounds, super helpful. I know some people are big on, I fall asleep to the rainforest. The thunder crashing, believe it or not, even if you don't wake up fully, it actually can disturb your sleep cycle. So I don't necessarily recommend that. I also am not a big fan, especially if you wind up getting up in the middle of the night to go to the bathroom, hearing rain certainly could set you up in an unhealthy way. So those are some things. We'll talk about a couple more, some things about avoiding. We talked a little bit about alcohol. Let's talk a little bit more about that. I understand the idea of having a glass of wine before bed will help you get sleepy. And actually, in theory, I don't have a problem with that. It's the second glass that becomes the problem. Once you go past a certain point, it becomes super unhelpful and you might fall asleep fast. However, you're going to run into a problem where it's not going to be restful sleep, and you're going to wind up having to probably get up more frequently in the middle of the night in order to go to the bathroom. Cigarettes, I called them smoking. 20-something years ago when I used to smoke, I called them smoky treats. Everyone has this idea of, well, smoking calms me down, which is a really interesting phenomenon that we've done in society, that having a cigarette helps me calm down. I will tell you, physically, that is just literally not true. Nicotine is a stimulant. It actually makes you awake. So right there, you're using a medicine or a drug that is actually going to keep you awake. So why does it calm people down? And this is a fun one. This is, people's minds a little bit, like if we do this in person, typically people just look at me like, the reason you calm down from smoking a cigarette is you're doing a breathing exercise. You're basically doing Lamaze breathing. You think about it, you go. So on that note, that can be also part of your ritual, is just doing a breathing exercise. You don't have to have the cigarette, and hopefully a lot of you are not smokers or reformed smokers. And if you're not, certainly there's programs out there to help you attempt to quit. But doing a breathing exercise, especially box breathing, and if you don't remember, I'll tell you real quick what it is. And if you don't remember, you can certainly Google how to do a box breathing or a YouTube video that can walk you through it. Box breathing basically is you breathe in for 4, count of 4, in 2, 3, 4, hold your breath for 4, 2, 3, 4, let out 2, 3, 4, hold 2, 3, 4. And if you do that cycle 3 to 5 times, and you can do more than that, but if you do that cycle 3 to 5 times, there are literal studies on this that actually show it changes your mind's chemistry. It literally will do some things with your neurotransmitters and actually physically influence you towards calming down. So if you're one that does have some thoughts going on in your brains a lot, that can be very helpful, that box breathing to kind of set you up as part of your ritual. You also want to avoid heavy meals before you go to bed because your body's going to be busy processing your heavy meal before you go as you sleep. And that certainly can keep you up. It's not going to give you restful sleep. I'm going to skip those 2 bullet points real quick. I want to go to the last one. There's only 2 things you ever should be doing in bed. One of them is sleeping, and I think everyone knows what the other one is, and that is fun time with your partner, fun time with yourself, any type of sexual relations. Do that in your bed, sleep in your bed, and don't do anything else. Do not watch TV in bed, even reading in bed. Have a comfortable chair next to the bed. You really want to only really do this. And again, it becomes part of that physical ritual where I know, my body knows, both intrinsically in my physical being and psychologically, that when I hop into that bed, it is sleepy time, because that's the only thing we do in that space. It is an unconscious drive. It is super helpful. So those are the only 2 things you want to do. Stress management and wind down time, we're going to talk more about as we go along. So stress management, one of the things that subconsciously or unconsciously can wind up driving a little bit of the anxiety that we face when we go to bed, whether the racing thoughts are about work, about family, about pressures, about what's going to happen tomorrow. I got to admit, even last night, thinking about presenting to all of you today, I was anxious and I was overthinking and I was having a little bit of a hard time going to bed, and I had to get back into my good habits and remind myself that it was going to be okay. So for those of you who are not football fans, the referee is showing us the call for safety. Now, this is not about football, and it's not about a football safety of going into the wrong end zone. But one of the things that unconsciously or subconsciously can be driving our anxiety is a feeling, a tenuous feeling amongst ourselves or inside of our being or coming from external pressures that really are making us feel unsafe. So how do we build in our mind a sense of safety, a sense of calm, a sense that we're going to be okay? And there's several different ways to do it, and I'll give you a couple of them. Some folks, what really works for them is while they're doing their box breathing, or as they're done doing their box breathing, they're going into a mantra about safety. They're going to a thought process as it relates to safety and what that looks like. I had one patient of mine who, it's interesting, and we could talk about the psychology, but it's for a different course, a different time. We talk about the psychology. He would imagine that his house became a bunker, right? And that the windows all became fortified, and all the negative stuff that was out on the street couldn't even make a dent in what was going on. And he imagined that in his mind's eye, and he really, really started thinking about what the shields, he had a lot of sci-fi stuff in that kept him interested. He imagined the shields going up and what how his whole house became this bunker that kept him safe. And honestly, he would do that every single night, every time the thought process, because sometimes your thoughts, you start thinking about these things and something else oozes in, like, oh, I have a big presentation at work tomorrow. He would notice it, he would set it to the side, go back to his bunker, and he wound up changing his cycle where it would take him 30 to 60 minutes to fall asleep every night, and he was falling asleep in less than 10 minutes. Just by repeating that over and over again in his hand, or this mantra of, I know I'm safe, I know I will sleep, and I know my body will take care of me. And repeating that over and over again and allowing yourself to set up some psychological safety for yourself. So we all know that stress really, all the stuff that's going on in these racing thoughts can really, really impact our ability to fall asleep and stay asleep. So in addition to our box breathing, in addition to repeating our mantra, we really want to set up our ritual to get us out of all of that stuff that impacts how we get to sleep. This is why I recommend reading a book you've already read, because what you're doing is it's allowing you to focus in on the characters of the book, of the scenario of the book, of the situation in the book. And it allows you to not worry about bills, not worry about work, not worry about, how are you going to get the kids to softball tomorrow at the same time you have to get one to one field and the next to the netter field. All those things are still going to be there for you in the morning, and you're certainly not going to solve them right there at night in bed. So it allows you to just take a little bit of time off by getting into the characters. And again, I really can't stress this enough. Read a book you already read so you don't get excited about what might happen to the next thing. Listen to music. If you do listen to music, again, a nice calming, easy rhythm. I actually have a playlist I created on my favorite platform that is called my sleep playlist. And I will set that up every single night. I ask my device to play that regardless of where I am. The nice part about setting that up is that you can take it with you. So if you travel, you can always take it with you. And it allows your brain to know that when I hear these songs playing, time to turn off. We talked about our mantra. We talked about having a safety plan, what that looks like. Again, you don't have to go through the sci-fi thing. That's what worked for him. But I encourage you to kind of find a way to convince your body and convince your mind that you're in a safe space. You're going to sleep. Your body does remember how to sleep every single night. It does figure it out, even if it takes some time. And you're going to get there over time. Another thing that we don't always think about that I think can be super helpful is taking a hot bath or a hot shower, and then having your house cool at night. Going from that hot to cold, coming back to our little bear that we saw earlier in the slides, it's that hibernation, your physical body going from hot to cold. Remind your body it's time to hibernate, so you can jump into bed after that. Some other things to do is really focus in on stress management. What does stress management look like? Now, in the bottom right corner here on the screen, we see my favorite, Dr. Sigmund Freud, which, whether you go to a Freudian therapist or someone else, it doesn't really necessarily matter. But, go into therapy and talk about the things that are driving the stress. Now, granted, I'm a hammer searching for a nail. I'm a therapist, right? So I think everyone should go to therapy. And I do actually believe that. So I do think it's important to, be able to talk about your issues and talk about them with a person who's going to have the knowledge of how to drive you through and how to do those type of things. And I do think therapy does work for this. And there are specialized sleep therapists out there. So I encourage people to look for them. You can see in the upper right corner a picture of one of my fur babies. So I tell you that not to have your fur baby sleep with you, but pets, we do know that petting a cat reduces your blood pressure. That is actual science. So having your pets, spending time with your pets, and having that engaging relationship with the pets can be certainly very helpful for reducing your stress, especially before evening, especially if your pets are there to keep you calm. Now I know not all pets are the best at that. I happen to be very lucky that both of my kids, my fur babies, are very good at reducing stress, and we do it together. I have yoga, any type of meditation I think could be super helpful, whether it's, there's so many wonderful guided meditations out there on YouTube that are free and available. I recommend for people who maybe aren't comfortable or aren't used to it or do have racing thoughts or do have anxiety, start slowly, do a 60-second meditation. Work your way up to a couple of minutes, work your way up to 5 minutes. And if your brain doesn't allow you to make it 5 minutes, you start following along, but then your brain drifts and starts thinking about something else, and you notice yourself thinking, do not beat yourself up. Everything in moderation, everyone, everything in moderation. So I do highly recommend that, be gentle with yourself, right? So if your mind slips and drifts off in one direction, notice it. Say thank you, I appreciate that, and bring yourself calmly back to the meditation. And again, you do as long as you can and as long as you can. Exercise, again, up there on the screen. And then medication we're going to talk about in a minute. I have feelings on medication, so we'll talk about that in a minute. But also be wary and be noticing what medications you take. I do take allergy medication as an example. Allergy medication does make me sleepy, so I take it at night. Why not get a helpful hand? There are other medications out there that don't. So as an example, a lot of pain medications, such as like Excedrin, migraine medication, have caffeine in it. We saw caffeine earlier. Remember, caffeine, here's my recommendation, which I don't always follow. No caffeine past noon. Because caffeine definitely can stay in your system and it negatively impact you. It is the #1 most abused drug in this country is caffeine. I certainly am an addict, as you know, and but you want to be very, very, very cautious. I don't follow the noon rule personally, even though that's what is the recommendation, but I do not have any caffeine past 3 o'clock in the evening, is my rule. Even though that is not, I want to give you what is actually recommended, which is noon. So that top left picture, that is actually a picture of the hospital I work in. That is not why it's there. I'm not suggesting anyone needs to go to the hospital right this moment. The reason I do that is to talk a little bit about having strong hobbies. Having a good hobby that occupies you during the day and is able to kind of distract you from some of the stuff that gives you stress can be super helpful. And a hobby can be anything. I put that there because my favorite hobby is flying planes. It's something I always wanted to do. So I got my pilot's license in 2010. And I will tell you, flying a plane de-stresses me. So does going on hikes. So does bike riding. So does playing with my cats. So does a lot of things. But I do think hobbies are super important to find something that you feel passionate about that can help you move the energy of your brain around. It is super important toward moving things forward. Talk a little bit about medication and why I'm against it, asterisk. Of the things on the screen, melatonin is probably the one I'll go the least issues with, and I am not always against medication. What I will tell you about stuff that helps you sleep is a couple of things. Ambien and Lunesta specifically do have side effects. And Ambien certainly can affect your memory. It can affect the quality of your sleep. Same thing with Lunesta. If you are using it, is really intended for short-term use. It is not necessarily intended for longer-term use, and should be helpful specifically to help you get into the patterns, to get your patterns right, to get you there. It is super addictive. There can be a lot of side effects. ZQL, Unisom are basically using Benadryl to help you get to sleep. That's fine. Again, it's not necessarily the greatest sleep you're going to get, and it can certainly create issues. I know, again, I wasn't feeling great over the weekend and I took NyQuil. I will tell you, NyQuil specifically, I get what I call NyQuil dreams, and they're unpleasant and they wake me up and it's not the quality sleep that I'm looking for. So if you are choosing to do this, I would try to set your sleep schedules as part of this and make it time limited. You really want to make any type of medication as it relates to sleep time limited and focused on. What to do when you still can't sleep. So you want to give yourself about 20 minutes, right? And if you really haven't fallen to sleep, then I want you to get back into your ritual of setting yourself up, whether it's get back out of the bed, whether it's go read that book, whether it's repeating your mantras to yourself. If it's your partner snoring and you can't handle it, go to another room, give yourself permission to move on, have that conversation ahead of time so nobody's panicking that you're not in the bed when you're supposed to be. You want to set yourself up for the correct thing. And the one thing you don't want to do, and we all know this, but we sometimes can't stop ourselves, we don't want to stare at the clock, right? In fact, I recommend don't even have the clock facing your bed. Because you will put an enormous amount of pressure on yourself to fall asleep, to force yourself to sleep. It does not work. There's no such thing as force yourself to sleep. It really only adds to stress and worrying about how much sleep you're not getting or how much time you have left on your sleep schedule. Another thing I do recommend is if you are worrying about something, have a little notebook next to bed, write down what you're worrying about, put it down and say to yourself, that's for tomorrow. That's for tomorrow. Here's my to-do list. Here's all my problems and all the issues I'm going to handle tomorrow. And I have it safe. It's right here on the bed next to me and I'm going to work on it tomorrow. So have a little thing that you can jot down. I always recommend to all of my patients, regardless of where they are, to keep a little notebook next to your bed. Because the other thing I do tell people to do, especially people who don't remember their dreams, is to make sure you write your dreams down when you wake up right first thing in the morning, because they'll somewhat be fresh, especially if they think it's something that is impacting their mental health. So I want to get it all wrapped up with a pretty bow and leave some time for some questions and answers, which hopefully I'll be able to do for you. So sleep and mental health, that's really what it's all about. Negative feedback loop can worsen sleep and mental health, right? So everything affects everything else, right? Stress and worry can affect our overall mental health, which makes us more start to worry as we go to bed and make us have insomnia and poor sleep, which will make us feel fatigued, which has us have difficulty focusing throughout the day, which makes us worry and stress, which makes our mental health decline. It is not this linear thing. One thing doesn't affect another. It is a feedback loop that we want to break. I studied a specific type of therapy called Gestalt, and Gestalt is all about our patterns. It's all about these cycles and these loops, and these loops that are created at a very, 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 very young age, almost in utero for certain things. And how do we look at the loop, which isn't working for us, and help us adjust and make a new loop that does work better for us? And that is why I will leave you with this part of this before we get to questions and answers and some other things out there. I'll leave you with this idea of being gentle with yourself, setting up a pattern that's going to work for you, starting at the end and working your way backwards in terms of looking at what time you want to wake up each day and going backwards on that. And really, again, when you have that stress and your worry, I said this a million times, I'll say it again, be gentle with yourself. We are human beings. We are programmed to worry. I do think something in the US society somewhat sometimes pushes us towards anxiety and worry. And that's okay. It's okay. We're kind of programmed that way. You're allowed to worry and stress. Set yourself up for success. Write it down on that piece of paper. Do some box breathing. Keep your ritual the same every single night. And hopefully these things improve. Two things. If it doesn't, go get help. Go talk to a therapist. Call a sleep center. I'll push ours. We do have one here at Jersey City Medical Center. I actually had our sleep center guru sitting here with me. Unfortunately, he got called out of the room in the middle of a presentation. But go to a sleep center because it could, again, there could be physical manifestations from sleep apnea, from other things that are really impacting it. You want to be able to talk to a professional. And the sleep centers are working with sleep therapists. They're working with sleep professionals. They're working with physicians who are all in tandem, making sure that you're going to have good quality sleep. So with that, we'll have some questions. We'll talk a little bit more. I'll do my best to answer. I see some of the questions have come up in the Q&A, and I'll do my best to answer what's there, and what I can't answer, I'm certainly going to get an answer and get back to you on. And I really appreciate you spending some time with me today. Hopefully you got something out of this. And if you did, awesome. If you didn't, that's cool too. It was nice to spend some time with you. So I will take a look here. Casey, is that how you want me to do it? Just look at the Q&A and kind of go, or?
Absolutely. Thank you so much, Robert. It's really fascinating. Yeah. Of course, I have questions myself, but yeah, let's go through and see what people have asked.
Do irregular sleeping habits lead to a higher chance of developing coronary issues? They certainly can. I'm not going to say it is 100% causal, but they certainly can. Having healthy sleep habits and being able to get the functional amount of sleep we need. And by the way, and I forgot to mention this, I even wrote it in giant big letters on my little script I have here, and I still forgot to mention it. We are human beings, and what works for some doesn't work for everybody. So, and again, don't put pressure on yourself. So some people function well at 6 to 7 hours of sleep, and it's okay, and it's not affecting their physical being. Some people do not. So again, don't put that pressure on yourself. But can it impact coronary issues? Certainly. If you're not getting enough sleep, it certainly can. One of the things that I know irregular sleeping habits was what was put there. People who work jobs who functionally change their sleep patterns as the result of their job. I know a lot of police officers do that. The police officers in my town do this, and I don't understand it. They work a 2-day on, 2-day off, 3-day on, 2-day off schedule, and they swap days and nights every off. So that's 2 days on days. They're off for 2 days, and they come back for nights for 2 days, and then they're off for 3 days, and then they come back to days again. That is awful for you. That is absolutely awful for you. So it's all about consistency. Setting your room up for success also includes making sure you have room darkening blinds if you're sleeping during the day, if you're working night shift. Making sure, again, you're only red lights, no blue or white lights. That I kind of went off on a tangent, but hopefully that does answer a little bit of a question. Any tips for tinnitus and getting back to sleep? My sleep guru would know the answer to that. And of course, he got called out with an emergency as you're walking out. So we will make sure we have the answer to that for you. And we'll get that out when we send out all of this stuff. I have not specifically heard about magnesium being helpful. The most helpful one specifically that we do talk is melatonin. That is typically the most helpful as it relates to helping people get sleepy. Is too much sleep not good for you? Can it lead to health issues? Too much sleep, asterisk, right? So typically too much sleep is indicative of perhaps, and again, this is all with an asterisk because everyone is unique and everyone is a unicorn. So it's a hard question for me to answer. But I will say, oftentimes if people are sleeping too much, it could be actually a sign of anxiety. and or depression, which of course do have impact on our physical health as well. There is so much research out there as individuals who struggle with mental health issues do wind up having physical issues that correspond with those mental health issues. But sleeping too much certainly can be indicative of that. In terms of, and when I say depression, by the way, I'm not necessarily even talking about major depressive disorder where you're really struggling to make it through the day. A lot of functionally depressed people, there's something called dysthymic disorder, can also wind up having irregular sleep patterns, including oversleeping, as a methodology of kind of the way their brain is being functioned and wired with the chemicals and also with their thought patterns. So people who do sleep too much, whatever that looks like for you, if you think it is an issue or there is a concern, again, I do recommend you speak to your physician about it and also talk to a therapist. Again, I'm a hammer looking for nails, so I'm always going to tell you to go see a therapist. What are things you can do to stay asleep and fall back to sleep? I tend to wake up every night around 2 a.m., find difficult to fall back to sleep. So unfortunately, that's become your pattern, right? Your body knows at 2 o'clock it needs to wake up. So it really is about playing with that pattern and playing with it in a way that is helpful. Whatever you're doing to fall asleep originally in the beginning of the night, we'll come back to that in a second, try to do that again at 2 a.m. And again, it comes back to those same types of the rituals that work to get you to sleep to begin with. So again, coming back to that mantra over and over and over again, I typically hear when people wake up in the middle of the night and have trouble falling back to sleep, it's because their brain went from 0 to 100 on them and they couldn't slow it down in time. And now they're stuck in that cycle of that racing thought that just can't stop. So allow it for like a second, thank it. It's looking out for you. All that worry is looking out for you. It really is. It wants the best for you. It wants to keep you safe. Tell it you have another way, and then practice your safety ritual. Practice your breathing. Think about how to keep yourself physically safe, whether it's the shields that are protecting you, whether it's the people around you that are taking care of you, even if it's just the mantra of, I know I'm safe. I know my body knows how to sleep and I'll get there, and keep working on it. And again, after 20, 25 minutes, you really can't go back, sit in a chair, focus on that breathing, focus on being in your body, allow yourself to get sleepy again, and then get back in the chair. I'll get back into the bed. All of those things can help. And you want to basically train your body because unfortunately, again, if it's every night at 2 a.m., your body knows it's thinking it's time to wake up at 2 a.m. And that is a common struggle, by the way. That is not certainly something we should do. So really focusing on those mantras and focusing on what that do. And if it really doesn't work, that last, bastion, if you have your sleep playlist, if you have your sleep book, go back to it real quick and go check in. If you, after that 20 minutes, your mantra hasn't worked, your breathing hasn't worked, you're allowing yourself to race a smidge and then bringing yourself back hasn't worked, go into your book, go into your playlist and allow that to help. Restless legs, any recommendations? That is why I had my sleep guru here with me. I'm going to go ahead and answer that for you. Specifically, when we send this all out, my buddy Randy, who runs our sleep center here, which literally is on the other side of this wall. It's a shame that he got it pulled out, but I will get you some tips on restless leg and I'll make sure that it's sent out with us. Other questions I can answer?
So I have a question, Robert, and I want to thank you for this. And I don't know where to categorize it, but I know that when you're stressed, right, that affects your sleep. But what about when something stressful happens in your life and you get really tired from it? I've heard it on NPR only one other time, and it is something that if something very stressful is happening, say someone's in the hospital or something like that, I will just want to fall asleep immediately. And I don't know if that's a thing.
Look, it's how we process, right? And every individual is different. Some people go one direction, some people go the other direction. It's all how we process the stress and anxiety of our lives. And by the way, stress is not always a bad thing. Stress can be a very, very good thing. I was super stressed before this all started, and I think it helped drive my presentation, right? So it can be helpful. So in this situation where you're experiencing bananas level stress, that is stress about something that is discomforting, loved one in the hospital, stuff like that, and your body naturally is getting sleepy and tired, it is your body's way of saying, this is too much. I need to take a break so I can wake up and get refreshed and relaxed and attack this problem. I don't have a problem with that. The only issue would be is if you are not in a safe place to be able to rest, you obviously can't rest. And what can you do to have a sense of calm until you have the ability to take care of your needs in a different way, right? So even if, sometimes people are at work and they're really, 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 really sleepy. And if you're doing a job that requires your full attention, such as airline pilot, by the way, speaking of that, number one profession for daydreaming, airline pilot, think about that next time you get on a plane. But you're on a job that requires full attention and full of this, but yet you can't fall asleep. And what does that do for you? And how does that even impact your stress levels? Because it makes you more stressed because now you want to sleep, but you can't. It's just finding ways to have a sense of calm. And then when you have a safe spot to rest, you rest. I also highly recommend, by the way, on that note, and it's hard to do, especially in our society, if you are driving, even if you're driving to a place that you need to get to and you need to sleep and you feel your body, driving while sleepy, honestly, depending on how tired you are, is actually worse than driving drunk. Like, pull over, rest your eyes, do what you need to do to take care of yourselves. We don't value that enough in our society. Take care of yourself. If your body's telling you need to rest, then please rest. Sorry, really long-winded, Casey, but what else you got?
No, it's perfect. But this is one that I've heard, and I hear it from older people in my life too, that as you get older, you don't need as much sleep. I mean, is that true?
Yes and no. I mean, we wind up sleeping less as we get older. Do we need as much sleep? Yeah, but what winds up happening, especially once you retire, you sneak in those naps. So you wind up sleeping less at night, and your patterns change in terms of like what time your bedtime is, what time your wake up time is. A lot of older people wake up earlier. And again, that's just how their scenario has gone over time. So yeah, all of that does impact it, but then you wind up, and please tell me, my poppy he was always checking his eyelids for holes in the middle of the day just to see, whatever. So yeah, do we need less sleep over time? Not necessarily. We just wind up sleeping in a little bit of a different pattern.
Okay, perfect. Well,
Does warm milk help? Warm milk does help, 100%. And lavender, yes, also does help. There's studies on both of those.
My mother swears by warm Ovaltine.
Yes, those were in my notes too, and I forgot to talk about them. But thank you so much. I appreciate you, Marianne, for bringing that back. Yes, 100% those do work.
Oh, excellent. Well, Robert, thank you so much. We are running out of time. I want to ask you, do you have anything that you'd like to share with us before we go?
Yeah, I will share. I do have a couple of things here that'll be there's some different resources that you guys can go to that has a ton more information than I could squeeze into 45 minutes. And I end on this picture. And I am a proud New Jerseyan. I know our state doesn't always have the best reputation. I don't really care. I love our state. I am truly a New Jersey person. This is taken in Atlantic City. Of a beautiful sunset, and the reason I put it here is for a couple of different reasons. One, go to New Jersey. It's beautiful here. It's an amazing place. Go to the shore this summer. And remember, we are so good. We are so good at being hard on ourselves. If you got anything today, in addition to your sleep patterns and what's going to help you get good sleep, which will help you have good mental health, is be gentle to yourself, be gentle to others, because you do not know how they slept last night. And I don't just mean that, in terms of actually how they slept, but I also mean it metaphorically. We don't know what necessarily happened. So be gentle to each other. I really hope you got something out of this today. And yeah, take care of yourselves, take care of each other. Thank you for letting me spend an hour with you today.
Thank you so much. Thank you, Robert, for being with us. It's something that we all struggle with, and everybody has their own way of dealing with it. But I know almost everybody I'm friends with and family members have a hard time falling and staying asleep. So this is super helpful. I just want to thank everybody for being with us today, and to remind you that you'll be receiving a recording of today's webinar and the PowerPoint slides as well. Our next webinar, Building a Better Culture in the Workplace, will take place this Friday, May 3rd at 11 a.m. So by all means, feel free to register, bring your friends. So until next time, for Robert Winston of RWJ Barnabas Health Facility, this is Casey Skorecki, thanking you so much for stopping by, and have a fabulous rest of the day and a restful night's sleep tonight.